Assalamualaikum doctor. In this video I am discussing about cervical lymphadenopathy, that is a video station coming on, and the opening statement like school age child with fever and swelling in the neck, and UK come, that is Epstein-Barr virus, school age child with rash, maculopapular rash and petechial rash and tonsillitis, white spots. Examiner said suggests it is a case of Epstein-Barr virus, that is infectious mononucleosis. So I am telling them what are the differential diagnosis of lateral neck swelling, that is acute in unilateral or reactive upper respiratory tract infection, streptococcus pneumonia, skin infection group streptococcus, staphylococcus aureus, dental infection, anaerobes. Then Kawasaki disease, cat scratch disease, these are. So you understand that upper respiratory tract infection, any viral infections, Kawasaki cat scratch disease. Acute bilateral reactive like viral upper respiratory tract infection, Epstein-Barr virus, cytomegalovirus. They have generalized lymphadenopathy and hepatosplenomegaly. Features of Epstein-Barr virus once come. Epstein-Barr virus features is that school age child with rash, maculopapular rash, petechial rash and tonsillitis, and they have splenomegaly present. So that is the acute bilateral. Subacute are like non-tuberculosis, we can tell that tuberculosis. Then we are going reactive in any neoplasia, lymphoma, neoplasia or lymphoma, leukemia, soft tissue tumor, and systemic onset of GISLE. So we understand acute are, we can tell that cat scratch disease, it can be any upper respiratory tract infections, okay, it can be any Kawasaki disease. And the acute unilateral, bilateral like Epstein-Barr virus, we keep upper respiratory tract infection, Epstein-Barr virus, cytomegalovirus. And subacute or chronic case, we can take tuberculosis, neoplasia like leukemia, lymphoma, soft tissue tumor, leukemia, lymphoma, soft tissue tumor, and systemic onset of GIA SLE. These are the associated with lymphadenopathy. So what history would like to ask? First of all, onset, course and durations, what increase or what decrease. Any fever, weight loss affecting his activity. So any fever, weight loss affecting his activity, any neck deviation or torticollis, shape of the head, any discharge from the swelling, any skin redness, is it painful or not, any contact with cat or scratches in the arm, any other lymph node swelling in any other part of the body, any rashes in the body, bruises, bleeding from body orifices, history of any trauma, any cough, shortness of breath, chest pain, night sweating, night fever, vaccination status, especially the BCG vaccine, any dysmorphic features, any other family member with similar condition, history of travel recently. So according to, we are asking OCD, increase, decrease, fever, weight loss, activity, sleep. Then neck deviation, head size, discharge from the swelling, skin redness, itchiness, painful, painless, contact with cat or scratches, any other lymph node swelling, any another part of the body, any rashes in the body, bruises, bleeding from body orifices, history of any trauma, any cough, shortness of breath, chest pain, night sweat, night fever, vaccination status, especially the BCG vaccines, any dysmorphic features, any other family member with similar condition, history of travel recently. Now about the what examination we'd like to do. So airway, breathing, circulation, ABC, vitals, hydration status, very important because shrunken eyes, urine amount in diaper, skin turgor and anterior fontanelle. ABC vitals. General examination for all the lymph nodes like axillary, supraclavicular, suprasternal and growing for other nodes. Skin examination over the swelling for signs of inflammations. Skin examination for any cat scratches and BCG scar. Abdominal examination for hepatosplenomegaly. Testicular examination for exclude malignancy. ENT examination for the throat and the tonsil. So examination, we understand ABC vitals, general examination, VCG, site, other lymph node examinations, abdomen examination for HSM, and ENT examinations. IENT examination for throat and tonsil. Throat and tonsil affected in white coated tonsil occurring Epstein-Barr virus infectious mononucleosis. So what is your management plan? Investigation, urgent investigation if any of the following are noted. When we do investigations, lymph nodes, number 1, supraclavicular or suprasternal diagnostic of significant pathology, more than 2 cm at 4 to 6 weeks, growing more than 2 weeks and not return to baseline less than 1 cm in 8 to 12 weeks. So it is not improving, size is increasing, more than 2 weeks it is growing, not coming back or decreasing in size. And other signs of symptoms are petechiae purpura, respiratory compromise, dysphagia, hepatosplenomegaly, also need to exclude Epstein-Barr virus, weight loss and night sweats, TB, malignancy, early investigations, so weight loss and night sweating, very important. Persistent fever more than 2 weeks. What are the tests we done? Lab or full blood count, film, ESR, CRP, LDH, liver function test only if suspected viral infection. Serology for toxoplasma, cytomegalovirus, and Epstein-Barr virus. Culture sensitivity from the discharge if present. Blood culture sensitivity. Chest X-ray, we find hilar lymphadenopathy on chest X-ray. Refer for biopsy, suitable node. Hilar lymphadenopathy significantly increasing likelihood of neoplastic disease. Ultrasound scan in acute lymphadenitis, high sensitivity and specificity. Okay, then CT also we do. So discuss the ENT biopsy in certain situations. When we go for ENT biopsy, atypical mycobacterium infections and features of highly suggestive of neoplasia. Treatment, systemically well and not less than 2 cm, no treatment. GP follow-up up to 2 weeks. Patient is well and less than 2 weeks GP follow-up. If acute, co-amoxiclav oral 48 hours. If improved, then continue for 10 days. And if chronic more than 6 weeks, co-amoxiclav for 2 weeks till result of investigation appear. And atypical mycobacterium, ENT referral for surgical excision. So our case is Epstein-Barr virus. It can become Epstein-Barr virus. We know that they have splenomegaly present and abdominal pain also present. A teenage girl, white coated tongue, and also after giving amoxicillin, ampicillin, there is rash appear. So there is it is infections mononucleosis. It is acute. So we give the GP follow up and the bed rest because splenomegaly, splenic rupture can be present, and supportive treatment. And investigation we find CBC lymphocytosis and atypical lymphocytosis. That is we find. And investigation are heterophil antibody test, mono spot test. These are the tests we do if they ask in Epstein-Barr virus. Another also they ask about the lymphoma. So what happened in lymphoma? What is the treatment we will give? Lymphoma, we do the full blood count, ESR, CRP, liver function test, blood cultures, as usual urine, throat swab and nose, CS X-ray, secondary immunoglobulin, GAM, serology test, Epstein-Barr virus, cytomegalo, HIV, SARS-CoV-2 antibody, these are, and also selective or echocardiogram, bone marrow, serology, autoantibody, immunoglobulin E, immunoglobulin D, gastric aspirate, ophthalmologist, okay, CTMR, everything they are doing. Normally, critical ill see the sepsis treatment, meningococcal guideline, tuberculosis treatment, discuss with the regional pediatric infectious diseases consultant and local TB service. Okay, so this is all about cervical lymphadenopathy history. What history you ask? I am telling again. Onset, course and duration, increase, decrease, fever, weight, activity, sleep. We are going the swelling itself, like it is painful, painless, size is increasing or not, or decreasing or not. Any other part, any swelling, then abdomen, any distension of the abdomen, hepatosplenomegaly, fever, night sweat, lethargic. These are the chronic tuberculosis features. We are VCG vaccine, very important. Family history, any chronic condition child is suffering. Any what about his throat, nose and throat. These are the features we will search, and we know the degree of cervical lymphadenopathy. It can be upper respiratory tract infections, it can be cat scratch disease, it can be Epstein-Barr virus infections, mononucleosis, cytomegalovirus, it can be the chronic cause tuberculosis, leukemia, lymphoma, any neoplasia. Then we can go for systemic onset of GIA, SLE. So these are the DD we can keep, and treatment we know that less than 2 weeks it's GP follow-up, and if it acute we give co-amoxiclav orally, and if not improving then co-amoxiclav we give. So this is all about cervical lymphadenopathy video station. Thank you.